is Dr. Beulah Jacob. I work as a gynecologist at the Texas Health Presbyterian Hospital. One of my patients came with a disorder called endometriosis, so I'm going to talk about that today. Endometriosis is a disorder where the tissue that normally lines inside the uterus grows outside the uterus. And the primary symptom of endometriosis is pain in the pelvic, and it usually hurts more when women are in the menstrual period. Other symptoms are pain with intercourse, pain with bowel movements, and excessive bleeding and infertility. Sometimes individual could experience fatigue, constipation, and nausea as other symptoms. For endometriosis, as doctors, we usually perform pelvic exam, ultrasound, and MRI. We usually give a medication called analgesics to reduce the menstrual cramps. After that, we will ask the patient to do a laparoscopy, which is the removal of endometrial tissue, and sometimes hysterectomy, which is the removal of uterus, fallopian tubes, and ovaries. For therapy, we suggest hormone therapy, where it is effective in reducing the pain of endometriosis. And we ask patients to eat high fiber foods, especially fruits, vegetables, nuts, whole grains, and beans. We also ask them to eat more sources of omega-3 fats, magnesium-rich foods, where it can help to soothe the uterus and reduce pain. Before we treat any patients, we consider several factors, like how severe their symptoms are, their age, and if they want children. So the patient that came was 30-year-old Asian female from a middle-class family, and she have no previous medical issues. So as a doctor, I will recommend her for getting a pelvic examination, then ultrasound, and at last laparoscopy. If it can be removed through surgery, I think it is the best idea for it, so it won't grow more and it won't weaken the patient. Individuals can't prevent endometriosis, but there are ways where they can reduce the chances of developing endometriosis, especially endometriosis, by lowering the levels of hormone estrogen. Estrogens helps to thicken the lining of women's uterus during a menstrual cycle. So to lower estrogen levels, we doctors suggest or recommend them taking birth control pills, patches, or vaginal rings. We also ask them to do a lot of exercise, because working out can help the body to keep weight down and maintain a low body fat. Last, we ask them to avoid caffeine and alcohol, because women who drink a lot of alcohol have more chances of developing endometriosis, because alcohol can raise the amount of estrogen our body makes. So it is better for women to take these recommended prevention into consideration if they want to have children, because endometriosis, if women develop endometriosis, it is very hard to have kids, and it is one of the main cause for infertility. So as doctors, we recommend eating a lot of healthy foods, and trying to exercise and to maintain a body weight, and to definitely avoid caffeine and the intake of alcohol. Thank you.